And in terms of the polls, if you have worked with people, are you like Natasha, who found that a lot of her patients were sleeping 6 hours or less? I think she mentioned at one point she saw a lot of people saying they were only sleeping for 5 hours a night. I mean, if that's the case, if you compare that with what we have here in this chart, which is actually a compilation of different recommendations. So when we were creating this this table, we actually looked at different what different organizations were recommending, looked at different studies, and then we compiled it. So if you look here, 4 to 12 months, 12 to 13 hours is what's recommended. 1 to 2 years in age, 11 to 14, 3 to 5 years, 10 to 13, 6 to 12 years, 9 to 12, 13 to 18 years, 8 to 10, 18 to 60 years, 7 plus. Now, what I want you to realize, and I think you all know, if you have children, you see how much sleep they need, right? During the day, during the per night. 5 to 6 is common even for those that don't have new babies or shift work. That's what Natasha said. She's writing in the comments. Yeah, I know, it's not a lot, right? So when you compare that to what you should be getting between the ages of 18 to 60, it's honestly not a lot. It's not enough. And if you look at the earlier part of the life cycle, when you have children, you know how much sleep they need, right? Then as they enter elementary school, they're around 6 to 12 years of age, they need still a lot, but less. And then at 13 to 18, they're closer to us in terms of the kind of sleep they need, but they still need 8 to 10. It's quite a lot. And the reason why is they're still developing, and sleep is so critical to development, especially cognitively. And I just want to remind everyone that even in the 18 to 60 years category, remember that you're still developing in terms of your brain. It's still developing until your mid-20s. So even if you're 24 years old, you still need that sleep in order to especially develop the more emotional side of your brain. Right, Mayra? Is that correct?
Right, that's absolutely true.
Okay, and so I'm just going to go quickly to the next slide and just explain, segue into the whole idea of we live in a pandemic. We're living in a pandemic right now, right? It's COVID-19, but in terms of chronic sleep deprivation, we have public health. There's a public health epidemic where people are not getting enough sleep. So if you think about it, we're living in a pandemic, but even prior to that, we were in a pandemic, and it is the sleep one that we are experiencing now. And okay, what about over 60 years of age? If you're over 60 years of age, what happens to you in terms of the life cycle is that you still need 7+ hours of rest a night, of sleep a night. But the thing is, even though you need that much, it becomes more challenging as we grow older to attain that sleep, because our sleep sort of becomes a little bit more fragmented. People don't get as much restorative sleep as they used to when they were younger, but the thing is, you still do need it. Okay.
And also people tend to go to bed earlier than before.
Exactly.
They shift a little bit on the earlier side.
Right. And so Luke is now writing, with neurogenesis wise, with exercise, there's hope.
Okay. Yes, absolutely.
Okay. And so in terms of the presentation and sleep deficits, so in terms of sleep deficits, what happens is if you don't have enough rest, you actually build a sleep deficit, and Mayra is going to explain more about that now. Right, Mayra?
Right. In sleep medicine, sleep deprivation is defined based on sleep duration, which is the total amount of time that a person spends asleep. In reality, it's just more than how many hours you are sleeping. And then we talk about sleep deficiency, sleep insufficiency, sleep debt, because unfortunately, we cannot save sleep. We haven't evolved that way. We don't have like a fat cell to store our sleep and then make up for lost sleep. We can make a little bit up for lost sleep, but not really. So when we accumulate a lot of sleep debt, we go into something that is called sleep deprivation. And people, it's not exactly the same as people with insomnia that have trouble sleeping when they have time. It's a little bit more complex because it's in contrast, it's people that are able to sleep and they decide not to sleep whenever they have time because they don't have enough time allocated for sleep as a result of behavior choices or for everyday obligations. And there is two kinds of sleep deprivation. There is acute sleep deprivation and there is chronic or 24-hour sleep deprivation when we pull an all-nighter. And it's not the same. But humans are the only species that deprives themselves of voluntarily sleeping. Do you know that we sleep an average of 1 hour less than we did 100 years ago? And then the next, what is the impact of loss of sleep? Trust me on this one. Sleep is the fountain of youth. We used to believe that just exercising and eating right were important. But now we know that the pillars, the most important thing that we can do for our health is get a good quality of sleep, enough time and enough quality. Because in those, we base our sleep performance. Because you all know that we cannot work out whenever we are really, really tired. And even if we do, our performance goes on the lower side. We'll talk about that a little bit later. But also, we don't make enough we don't choose good food, like healthy food, when we are sleep deprived. We tend to choose more like on the carb and on the hypercaloric food. We'll talk about that also a little bit later. I also want to emphasize, because I cannot emphasize enough, that it is fundamental for well-being, for our physical, for our mental development, for our mental health, for our memory. We now know that it is related with Alzheimer's disease if we don't get enough sleep. We thought it was the other way around because we, like scientists, started to do some research and they found that people with Alzheimer's weren't sleeping okay, but then they thought, what if it's the other way around? And it seems that it's one risk factor associated with Alzheimer's. And we now know that it has cardiometabolic implications for our heart health. And I just want to invite everybody in the audience to the stigmatized sleep. Sometimes people who sleep enough are categorized as lazy. And no, we shouldn't be doing that because, like we live in this world where time is money and you sleep when you are dead. But no, in order to become healthy seniors, we need to sleep. Trust me, it is the fountain of youth. What do you think, Sheryl?
Absolutely, absolutely. And you know what? In terms of, okay, so I'm going to leave this slide is blank because I'm going to share with you a story. When I was creating, I was giving a talk, all right, on sleep, and I wanted to impress upon the audience for that talk the importance of sleep. And I was thinking, okay, let's think of a cool graphic or, some really interesting metaphor, something cool like that, pretty even, that I could put up on a slide that will grab their attention and really show how important sleep is. And in order to do and create that graphic, I had to create a table for myself. It was pretty much an Excel spreadsheet or was it a Word doc? I can't remember which one, but it was a table, not the best looking table in the world, but I kept adding and adding cells and adding to it because I had to make it for myself so I could understand sleep, right? And then I realized, why am I trying to make this so pretty for a slide? Why don't I just put it up? Because if anything is going to show people how central sleep is to their health, to their well being, to their performance, to even their relationships, this would be the table. Now, I don't want you, the people who are watching this either on replay or who are here live with us, to go out there and memorize it. This was created for me. I just want you to focus on the density of this table. Realize too that I condensed this information, okay? And this density in and of itself is indicative of how central sleep is, okay? So just going to show it to you. All right. So, what I found, I put it in the table and I'm like, wow, so it's related to the physical, the neurological, the mental, the emotional, the cognitive. And wow, okay, wait, obesity? When I was reading this, I was like, when I was going through it, I was like, the research says it's related to obesity. Really? How? Cardiovascular disease, diabetes, Alzheimer's, cancer, depression, anxiety, mood disorders, microsleep, which is sort of when you're driving, or imagine driving and then part of you fall asleep for an instant. And that's actually, there are major implications for that in terms of, accidents. And Mayra will go over that another time. But all of these things actually end up having a big impact, not just on your health and well being, but also the health and the well being of other people around you, right? So you have things like rigid thinking, decreased attention, poor memory, emotional regulation also becomes an issue. So, working with teams, if you're working and you're working with the public, the service quality, it affects so many different things on so many different levels in our society, right? And so I just wanted for you to realize that. And in terms of then your own sleep or the sleep of your clients and your patients, what can you do to have better sleep? And so we were Myra and I were talking. We're like, okay, we have 4 quadrants. What could you put in these 4 quadrants to help people sleep better, right? So first step, first of all, understand sleep, right? Understand it. If you have some sort of an idea of what the sleep architecture is like, what normal sleep looks like, then you have a better understanding of how you are in relation to that. Had I known what other people's sleep was like, maybe I would have understood my own sleep better, right? Then after that, know your chronotype, implement sleep wellness strategies, and maintain sleep wellness. We'll go over the other quadrants, but for right now, we're going to work with the first one, which is understanding sleep.